Picture this. It's 2 in the morning.
Hmm.
The house is completely quiet. The glow of your smartphone is literally the only light in the room, and you are just entirely down a rabbit hole on the internet.
I've all been there.
Right. You're navigating that overwhelming, incredibly murky world of online medical information.
Yeah.
You are searching for solutions. And not just any solutions, but answers to deeply personal, potentially really embarrassing health issues.
The kind of things you don't really want to bring up at a dinner party.
Exactly. You are looking for a fix. A silver bullet. Something that promises to just make a complicated problem simply vanish.
Yeah, it's a very vulnerable place to be, honestly, just staring at that screen in the middle of the night.
Totally.
You're looking for clarity, but the internet has this tendency to offer a chaotic mix. You get miracle cures, dense medical jargon, and then these user reviews that just sound almost too good to be true.
Right. And it becomes practically impossible for you as a patient to separate the actual science from just aggressive, unregulated online marketing.
It really does.
So our mission for this deep dive is to act as your guides through a very specific, highly discussed corner of that medical internet. We are pulling our information today directly from the iMedix medical content engine.
Which is a fantastic resource.
It really is. For those who might not be familiar with it, iMedix is an independent medical information platform. It's a massive drug database.
Yeah.
And we are going to be exploring their clinical data, their safety warnings, and honestly, perhaps most fascinating of all, the real-world community discussions happening right there on their platform.
The iMedix database is incredibly valuable for a deep dive like this. It doesn't just list the textbook definitions of a medication.
Right.
It synthesizes physician reviews, prescribing guidelines, and actual patient interactions. It gives us a really three-dimensional view of how a drug exists in the real world, not just how it functions in some controlled laboratory setting.
Exactly. And the specific drug we are putting under the microscope today is a fascinating one. It's highly discussed, heavily searched, yet officially unapproved. It's a combination pill known online as Tadapox.
Tadapox.
Yeah. If you have spent any time at all looking into men's sexual health forums, you might have seen this name floating around.
Oh, absolutely.
It is marketed as a sort of ultimate solution, like a super pill.
Yeah.
But we are going to look way beyond that surface-level internet hype today.
We have to, because when you actually look at the data provided by the iMedix platform, you realize that the narrative being sold on these unregulated pharmaceutical websites is missing some critical, potentially life-saving context.
Really important context.
Yeah. We are going to dissect the dual pharmacology of this drug, the severe safety warnings attached to it, its incredibly murky regulatory gray area, and those actual conversations happening in patient communities who are using it.
This deep dive is entirely about separating medical reality from online marketing fiction. Okay, let's unpack this. The iMedix database outlines that Tadapox is marketed specifically to adult men, and it attempts to fight a battle on two entirely different fronts simultaneously.
Two very different fronts.
The two conditions it claims to treat are erectile dysfunction, or ED, and premature ejaculation, or PE.
Right.
Treating one of those conditions is a pretty standard medical procedure at this point.
Very common.
But treating both at the exact same time with a single tablet, that seems like an incredibly complex chemical balancing act.
It is a pharmacological tightrope walk. To really understand why, we have to look at the anatomy of this pill.
Okay.
Tadapox is what we call a fixed-dose combination tablet. It compounds two very different active ingredients with two entirely different physiological targets into one single dose.
Let's start with ingredient number one then. The iMedix profile identifies this as Tadalafil, with 20 milligrams present in a standard Tadapox tablet.
Right.
The data refers to it as a PDE5 inhibitor. So for those who aren't reading urology textbooks for fun.
Which is most people, I assume.
Right. What exactly is this inhibiting, and how does it address ED?
Well, tadalafil is the exact same active ingredient that you would find in the well-known FDA-approved medication cialis.
Okay, got it.
To understand the inhibition part, we have to look at the mechanics of an erection. When a man is sexually stimulated, his nervous system sends a signal that causes the release of nitric oxide in the erectile tissue.
Nitric oxide, okay.
Yeah. That nitric oxide stimulates an enzyme that produces a chemical called cyclic guanosine monophosphate, or CGMP for short.
CGMP.
Exactly. You can think of CGMP as the actual key that unlocks the blood vessels. It causes the smooth muscles in those vessels to relax and widen, allowing a massive influx of blood.
So CGMP is the chemical that actually gets the job done.
It is, but the body doesn't just leave those blood vessels open indefinitely.
Oh, right, that would be a problem.
Precisely. The body has a built-in off switch. That off switch is an enzyme called phosphodiesterase type 5, or PDE5.
Not PDE5 from the name.
There you go. This enzyme constantly breaks down the CGMP, essentially closing the blood vessels back up and ending the erection.
I see.
Tadalafil steps in and blocks that off switch. It inhibits the PDE5 enzyme, stopping the body from breaking down the CGMP.
Using an analogy here, it sounds less like a magical on switch and more like a plumber working on the hydraulics.
I like that.
It's like opening the floodgates so the water can rush in, but the floodgates only open when the initial biological signal is actually given.
Yes.
Sexual stimulation is still absolutely required for the tadalafil component to do anything at all.
That is a highly accurate way to look at it. It does not create an involuntary physiological response out of nowhere. It preserves and enhances the natural mechanism once it has already started.
Okay, that makes perfect sense.
But the really defining characteristic of tadalafil, especially compared to other ED medications on the market, is its timeline.
Right, I noticed this. The iMedix pharmacokinetics data notes something pretty staggering here. It says tadalafil has a massive 36-hour efficacy window.
36 hours, yes.
That's a day and a half.
Because of its specific molecular structure and how it binds to proteins in the blood, it is metabolized incredibly slowly by the liver. It stays active and circulating in the systemic blood supply for a day and a half. Clinicians often refer to this as a very long, very stable pharmacokinetic tail.
36 hours of hydraulic support. I want to bookmark that timeline because looking at the second half of this pill, it seems like we are setting up a massive biological collision.
We really are.
Ingredient number 2 is 60 milligrams of Dapoxetine. The iMedix profile defines this as a short-acting selective serotonin reuptake inhibitor, or SSRI.
Right.
Most people know SSRIs as daily medications for depression or anxiety. How does a psychiatric drug fit into a pill for men's sexual health?
It's a completely different application of the same mechanism. If tadalafil is the plumber dealing with blood flow, dapoxetine is the neurological modulator dealing directly with brain chemistry. It is specifically indicated for the treatment of premature ejaculation. To understand this, we have to shift our focus from the vascular system to the central nervous system, specifically the neurochemical ejaculatory reflex.
So we're dealing with the brain's control center for the entire process.
Expect.
How does serotonin factor into that reflex?
Ejaculation is a highly complex reflex, and the neurotransmitter serotonin plays a massive inhibitory role in that specific pathway. Simply put, higher levels of active serotonin in certain regions of the brain will significantly delay the ejaculatory reflex.
Higher serotonin means a delayed reflex.
Right. Normally, your brain releases serotonin into a space between neurons called the synaptic cleft to send a signal, and then the originating neuron quickly reabsorbs it to clear the space.
That is the reuptake part of the process.
Yes, and the SSRI steps in and blocks that cleanup crew.
So it traps the serotonin.
It temporarily traps more serotonin in that synaptic cleft, artificially increasing the localized serotonin activity. By doing this, dapoxetine successfully increases what the clinical data calls the intravaginal ejaculatory latency time, or IELT.
It fundamentally slows down the neurological trigger.
So that's exactly what it does.
But the iMedix data highlights a glaring difference in how this specific SSRI operates compared to the ones people take for depression. Dapoxetine is intentionally designed to be a very short-acting drug.
What's fascinating here is the sheer physiological oddity of combining these two specific molecules. Dapoxetine has a very brief half-life.
And not 36 hours.
Not even close. It is
Yeah.
not meant to build up in your system over weeks like a standard antidepressant. It is purely for on-demand use, engineered to peak quickly when taken about 1 to 3 hours prior to sexual activity and then rapidly clear from the bloodstream.
Which brings us to the fundamental contradiction of Tadapox.
Yes.
You have Tadalafil, which is this slow-rolling 36-hour marathon runner of a drug,
Right.
and you have Dapoxetine, which is a rapid-fire 1 to 3 hour sprinter. And they are mashed together into one single fixed-dose tablet.
It's a bizarre combination.
From a purely logistical standpoint, how is a patient supposed to manage that?
It makes very little clinical sense. If a patient takes the pill, the dapoxetine is going to peak in a couple of hours and then rapidly fade away. But the tadalafil is going to hang around in their bloodstream for another day and a half.
So if a patient tries to utilize that massive 36-hour window of the Tadalafil the next day, the Dapoxetine is already long gone.
Long gone.
They only have half the intended effect of the pill. But if they take another pill the next day to get the Dapoxetine back in their system,
They are going to severely overdose on the tadalafil
because it's still there.
because it is still highly concentrated in their blood from the day before. It is a clashing of timelines that makes safe, consistent dosing practically impossible. You cannot adjust the dial on one mechanism without completely throwing off the other.
That structural flaw leads us directly into the rules of engagement for this drug. Because the iMedix general instructions are incredibly strict about how to take this, and more importantly, how patients must absolutely not take it.
The absolute golden rule, highlighted across the prescribing information, is the strict 24-hour limit.
Never more than one a day.
A patient must never, under any circumstances, take more than one Tadapox tablet within a 24-hour period. And furthermore, the clinical efficacy and safety of taking this fixed-dose combination daily have not been established.
So it's not a daily vitamin.
It is entirely unproven as a daily regimen. It is strictly an as-needed intervention.
The instructions say to take it orally with a full glass of water, roughly 1 to 3 hours before anticipated activity, and swallow it whole.
Right.
But there's a fascinating caveat in the iMedix data that I think heavily impacts the real-world user experience. It explicitly warns about high-fat meals. It says that taking this pill with a heavy, high-fat meal can delay the absorption of the tadalafil component. Why does a steak dinner suddenly become a pharmacological hurdle?
This is a classic pharmacokinetic reality for many lipophilic or fat-soluble oral medications. When you consume a meal high in fat, your digestive system alters its behavior.
How so?
It prioritizes breaking down those complex lipids, which fundamentally slows down gastric emptying. The stomach holds onto its contents much longer.
Oh, I see.
So if that tadalafil pill is sitting in your stomach mixed in with a heavy fat-rich meal, it is not moving into the small intestine where the primary absorption into the bloodstream occurs.
It's essentially stuck in a digestive traffic jam.
Exactly. The onset of action is significantly delayed, and the peak concentration of the drug in the blood is blunted. It won't reach the required therapeutic threshold when the patient expects it to.
Think about the practical human implications of that.
They're huge.
You have a patient managing these deeply personal, anxiety-inducing health issues. They plan a romantic evening, a classic date night, which very often involves a rich, heavy dinner.
Very common scenario.
By doing that, they have inadvertently sabotaged the chemical absorption of the very pill they are relying on for later that evening.
Yes.
The biological choreography required to make this combo pill work effectively is incredibly demanding.
It really is.
You are asking a patient to perfectly time a 1 to 3 hour Dapoxetine peak, manage a lingering 36-hour Tadalafil window, and carefully monitor their dietary fat intake all at the exact same time.
It requires a level of physiological micromanagement that most people are completely unprepared for, and the complications don't stop at ingestion. They begin with how the drug is stored.
Right, storage. The iMedix data outlines specific storage parameters. It says it must be stored at room temperature, strictly between 20 to 25 degrees Celsius or 68 to 77 degrees Fahrenheit, and protected entirely from moisture and light.
Which is very specific.
Yeah, it sounds like standard boilerplate text on any medicine bottle, though. Keep in a cool, dry place. Why is the iMedix platform highlighting this so specifically?
Because it is a strong indicator of the drug's chemical stability requirements. These are complex, synthesized chemical compounds. Exposure to excessive heat, ultraviolet light, or humidity can cause the active pharmaceutical ingredients to structurally degrade.
So they break down.
They do. And when they degrade, they don't just quietly become less effective. They can break down into novel chemical byproducts that could be toxic or, at the very least, entirely unpredictable in their biological effects.
And when we consider where people are actually getting this drug, those storage parameters become a massive red flag.
Yeah.
Which brings us to the elephant in the room regarding Tadapox, the regulatory gray area.
Right.
Why isn't a drug that addresses two incredibly common issues readily available at a local neighborhood pharmacy?
The simple answer is that it is not FDA approved. But the nuanced answer requires us to look at the legal status of the individual components. As we established, Tadalafil by itself is fully approved by the U.S. Food and Drug Administration. Millions of men have legitimate prescriptions for cialis.
Right.
However, the second ingredient, dapoxetine, has a very different story. It is not approved for any medical use by the US FDA.
Now, to be fair to the global context here, the iMedix data points out that Dapoxetine is approved and actively marketed in several other countries around the world under the brand name Priligy.
Yes, that's true.
It has passed regulatory scrutiny in places like Europe, but in the United States, the FDA considers it an unapproved pharmaceutical agent. Why would the FDA reject a drug that Europe approves?
The FDA often maintains incredibly rigorous thresholds, particularly for drugs that alter central nervous system chemistry, like an SSRI. They weigh the clinical benefit against the potential for severe psychiatric or neurological side effects.
So it's a risk-benefit analysis.
Exactly. If the FDA determines that the risk profile of rapidly fluctuating serotonin levels outweighs the benefit of delaying ejaculation, they will withhold approval. Because dapoxetine is unapproved in the U.S., any pill combining the two, like Tadapox, is entirely unapproved, legally unauthorized, and cannot be prescribed or distributed through legitimate American channels.
If we connect this to the bigger picture, that regulatory status forces patients into a massive systemic danger zone. Because they can't go to their local doctor and pharmacy, they are seeking it out on the unregulated web.
And that's where the real danger begins.
They are buying from international online pharmacies that operate completely outside the bounds of safety oversight.
And the iMedix urologist notes on this topic are chilling. They outline the staggering real-world dangers of these international gray markets. When you bypass the regulated supply chain, you forfeit all quality control. Patients are rolling the dice on counterfeit medications.
What does a counterfeit pill actually look like in this context? Are we talking about sugar pills?
Sugar pills are the best case scenario. The reality is far worse. You might be getting wildly incorrect doses.
Like too much active ingredient.
Exactly. Imagine receiving a pill with 100 milligrams of dapoxetine instead of 60. That could induce a severe neurological crisis.
Wow.
You might be getting entirely wrong active ingredients, perhaps a completely different, cheaper chemical substitute. Or, terrifyingly, you might be ingesting harmful industrial contaminants introduced in unsanitary, uninspected overseas manufacturing facilities.
Contaminants like what?
Heavy metals, floor sweepings, toxic binding agents. These are all frequently found in intercepted gray market pharmaceuticals.
That is horrifying.
It gets worse. Add in the fact that these pills might sit in a sweltering 110-degree cargo container for a month during shipping, violating every chemical storage parameter we just discussed, and the risk becomes exponential.
But the iMedix guidelines stress an even deeper medical concern here beyond the physical risk of contaminated pills. They point out that even if you get a perfectly synthesized, chemically pure Tadapox pill, you are still only treating symptoms.
It is the definition of a chemical band-aid.
Exactly.
Erectile dysfunction and premature ejaculation are rarely just isolated mechanical failures. They are very frequently the body's alarm bells for severe underlying physiological issues.
Right.
They can be the very first physical manifestations of profound hormonal imbalances, early-stage neurological disorders, or intense psychological distress.
The database specifically mentions cardiovascular disease as a major underlying factor.
Yes. The blood vessels in the penis are significantly smaller than the coronary arteries supplying the heart. Plaque buildup and arterial blockages will manifest as erectile dysfunction years before they cause a full-blown heart attack.
So it's an early warning system.
ED is often the canary in the coal mine for systemic cardiovascular disease. When a patient orders a generic combo pill online to simply force their body to perform, they are silencing that crucial alarm bell.
That makes a lot of sense.
They are treating the symptom while allowing a potentially life-threatening underlying condition to go completely unchecked and untreated by a medical professional.
They are completely bypassing the doctor's diagnostic workup. They are self-medicating in the dark, without any baseline understanding of their own internal health.
Yes.
And the iMedix database makes it terrifyingly clear that taking these powerful chemicals in the dark is like walking through a minefield. The section covering drug interactions and contraindications is extensive.
It is a profound reminder that just because something is marketed online as a casual lifestyle drug does not mean it isn't a highly potent, hemodynamically active pharmaceutical agent.
Here's where it gets really interesting, and by interesting I mean objectively dangerous. The iMedix data lists an absolute contraindication regarding a class of drugs called nitrates.
In medical pharmacology, absolute contraindication is the strongest possible warning. It means under zero circumstances, with no exceptions, should these drugs ever be mixed.
No exception.
None. Tadalafil must never be taken with any form of organic nitrate or nitric oxide donor.
I know nitrates are usually tied to heart medication. We are talking about prescription angina medications, things like nitroglycerin, which are given to patients to prevent chest pain.
Correct.
But the database also flags recreational drugs, specifically amyl nitrate, commonly known in the club scene as poppers.
Yes.
What actually happens in the body if someone mixes Tadapox with a nitrate? Let's do a deep dive into that chemical collision.
We established earlier that tadalafil works by preserving cGMP, the chemical that relaxes blood vessels. Nitrates work by directly and massively increasing the production of that exact same cGMP to aggressively open up blood vessels around the heart to relieve angina.
Okay, so they both target the same mechanism.
Yes. If a patient combines them, they are hitting the gas pedal and cutting the brake lines on their vascular system at the exact same time. The result is a profound double vasodilation.
Double vasodilation.
The smooth muscle in blood vessels all over the entire body relaxes and widens simultaneously.
That sounds like it would cause the blood pressure to absolutely plummet.
A profound, uncontrolled, and extreme plunge in systemic blood pressure. The cardiovascular system suddenly loses the pressure required to pump blood effectively against gravity. Blood flow to the brain and the heart muscle itself drops precipitously.
And what's the outcome of that?
This interaction can rapidly lead to severe syncope, which is fainting, or far worse. It can trigger a myocardial infarction, a stroke, and it can absolutely be fatal. It is a massive hemodynamic collapse that the body simply cannot compensate for.
That is the cardiovascular minefield. But because Tadapox also contains Dapoxetine, the SSRI, the patient also has to navigate a neurological minefield.
Yes, the other half of the pill.
The iMedix safety advice details a massive threat known as serotonin syndrome.
Dapoxetine works by artificially trapping and increasing serotonin levels in the central nervous system. If the patient is already taking other drugs that affect serotonin pathways, the cumulative effect can completely overwhelm the brain.
What other drugs?
The iMedix data specifically lists a high risk of interaction with other daily SSRIs like Prozac or Zoloft, SNRIs, older tricyclic antidepressants, MAOIs, certain pain medications like tramadol, and even over-the-counter herbal supplements like St. John's wort.
If a patient accidentally overloads their brain with serotonin, what does that actually look like? The database says it becomes highly toxic, but what are the symptoms?
The symptoms of serotonin syndrome are rapid, cascading, and terrifying. The nervous system essentially short circuits.
Wow.
The iMedix database lists extreme agitation and restlessness, vivid hallucinations, sudden spikes in body temperature resulting in a dangerously high fever, severe muscle stiffness and rigidity where the muscles essentially lock up, and a dangerously rapid, irregular heartbeat.
That sounds like a horror movie.
It is a full-blown neurological emergency that can quickly escalate to seizures, coma, and death if the patient isn't treated immediately in an intensive care unit.
It's astounding that these are potential outcomes from a pill someone buys online to improve a date night.
It's a massive disconnect.
And the biological complications keep going. The iMedix database highlights the role of something called CYP3A4 inhibitors. What is CYP3A4 and why is it so crucial here?
CYP3A4 is a specific, highly active enzyme in the liver. You can think of it as the body's primary bouncer for clearing certain chemicals out of the bloodstream.
The bouncer.
Right. It is primarily responsible for metabolizing and removing tadalafil. But certain other medications, like the antifungal drug ketoconazole, or common antibiotics like clarithromycin, are potent CYP3A4 inhibitors.
So if a patient takes one of those antibiotics, they're essentially handcuffing the bouncer.
Precisely. They occupy and disable the enzyme.
Okay.
If a patient takes Tadapox while on one of these inhibitors, the liver cannot metabolize the tadalafil.
It just stays in the blood.
The drug becomes trapped in the circulation, and the plasma concentration builds up to highly toxic levels, drastically amplifying the risk of severe side effects and those catastrophic blood pressure drops we discussed.
And the database also notes it interacts dangerously with alpha blockers.
Yes, which are standard medications for enlarged prostates. Combining those leads to massive additive blood pressure lowering effects.
And then, towering above all these prescription interactions is the most common social interaction of all, alcohol.
Yes.
The iMedix urologist's advice on mixing alcohol with Tadapox is essentially a giant flashing warning label. Obviously, alcohol is heavily intertwined with the scenarios where someone might use this drug. Why is the combination so disastrous?
Alcohol is a central nervous system depressant, but it's also a powerful vasodilator. It relaxes blood vessels on its own.
So it's already doing what the Tadalafil is doing.
Exactly. Mixing alcohol with the tadalafil heavily exacerbates those vasodilatory effects, plunging the blood pressure down further. But when you introduce alcohol to the Dapoxetine component, the results are exponentially worse.
Because of the brain chemistry.
Yes. Alcohol heavily magnifies the nervous system side effects of the SSRI. The dizziness, the drowsiness, the cognitive impairment, all of it is amplified. But most critically, this specific combination heavily increases the risk of sudden severe syncope. Fainting. You are combining two substances that simultaneously destabilize your vascular pressure and heavily compromise your neurological alertness.
Given how aggressively this drug interacts with everything from heart meds to a simple glass of wine, the baseline side effects of the pill itself must be intense, even if a patient navigates all of those interactions perfectly.
They are. And the side effect profile is inherently complex because the patient is inheriting the adverse effects of both a PDE5 inhibitor and an SSRI simultaneously. Their body is fighting a war on two fronts.
Let's break down what the iMedix database categorizes as the mild and transient effects, the common annoyances that patients are apparently expected to just power through.
Right.
From the Tadalafil side, the data lists classic vascular responses. You have flushing, which is a sudden redness and intense warmth in the face and neck due to the expanding blood vessels. You have profound nasal congestion because the erectile tissue in your nasal cavity responds to the drug exactly like the erectile tissue elsewhere.
People don't often realize that about the nasal cavity.
Yeah. You have dyspepsia or severe acid reflux because the smooth muscle in your digestive tract relaxes too much and allows stomach acid to escape. And then there are the notorious back and muscle aches, which are deeply tied to how tadalafil affects certain specific enzymes in muscle tissue over that long 36-hour window.
And while the patient is dealing with all of those vascular issues, the Dapoxetine side kicks in with classic initial responses to a sudden influx of serotonin in the gut and the brain.
Like what?
The profile lists pronounce nausea, sudden, disorienting dizziness, and a general feeling of profound systemic unease.
But the iMedix database forces us to look beyond those transient annoyances and examine the severe structural risks. A major one tied heavily to the Dapoxetine component is the neurological risk of syncope or fainting.
Yes.
Now, fainting might not sound like a life-threatening emergency on its own, but the context of how and when it happens seems crucial. The iMedix data outlines what they call prodromal symptoms.
Prodromal symptoms are the body's desperate final warning signs that systemic blood pressure has dropped too low to sustain consciousness. It is the mechanics of severe orthostatic hypotension.
Can you break that down?
When a healthy person stands up, gravity naturally pulls their blood down into their lower extremities. A healthy vascular system instantly senses this and tightens the blood vessels in the legs to forcefully push that blood back up to the brain.
Right.
But Dapoxetine, especially when combined with the vasodilatory effects of tadalafil, heavily impairs that crucial reflex. The blood pools in the legs. The brain is momentarily but severely starved of oxygen.
The database says the prodromal warning signs kick in right before the collapse.
Ah.
Sudden, intense nausea, cold sweats, extreme lightheadedness, tunnel vision, and a massive spike in anxiety.
That's your body telling you you're about to go down.
The practical advice directly from the iMedix source material is incredibly stark. It says if a patient feels these symptoms, they must lie down immediately so their head is lower than the rest of their body, or sit down with their head between their knees.
By lying down and elevating the legs, the patient is using gravity to force the pooled blood back toward their heart and brain, mechanically restoring perfusion.
And if they don't do that?
If they try to fight it, if they try to stay standing or walk to the bathroom, they will lose consciousness, they will collapse, and the resulting fall can cause severe blunt force head trauma or bone fractures.
Just from standing up.
This exact physiological mechanism is why the iMedix guidelines heavily caution against driving or operating any heavy machinery while using this medication, because a sudden orthostatic drop behind the wheel is fatal.
It is a profound neurological risk. But looking at the other side of the pill, there is also a severe urological emergency associated with the tadalafil component that we absolutely have to discuss. It is a condition known as priapism.
The iMedix database defines priapism as a painful, abnormally rigid erection lasting more than 4 to 6 hours. This is not just an inconvenience. This is a true, highly time-sensitive medical emergency.
I think there is a really dangerous misconception online. often fueled by crude internet jokes or spam emails, that a 4-hour erection is somehow a sign of the drug working really, really well.
It's a terrible misconception.
Because the clinical reality outlined here is incredibly dark.
Biologically, it is catastrophic. In a normal, healthy erection, fresh, oxygenated blood flows in through the arteries, and eventually deoxygenated blood flows out through the veins. In priapism, that outflow mechanism is completely paralyzed.
So the blood is just trapped.
The blood is trapped in the corpus cavernosum. Because it isn't circulating, it rapidly becomes deoxygenated and highly acidic. This toxic, stagnant, acidic blood begins to literally suffocate and destroy the delicate, spongy tissue of the penis.
That sounds incredibly painful.
It is. If emergency medical intervention, which often involves a trip to the ER for procedures to physically drain the trapped blood with needles, is not performed promptly, the tissue dies. It results in permanent, irreversible physical damage and permanent, untreatable erectile dysfunction.
The unregulated drug designed to temporarily fix the problem ends up causing permanent, irreparable harm.
Yes.
That is a devastating risk profile. And beyond these specific physiological side effects, the iMedix safety guidelines carve out very specific, special populations for whom this drug is strictly unsafe.
Absolutely.
Obviously, it is not indicated for women, and it is strictly contraindicated during pregnancy and breastfeeding. It is absolutely unsafe for adolescents under the age of 18, as their neurological and vascular systems are still undergoing critical development.
Right.
But the guidelines also heavily flag elderly patients. Why is an older demographic at such a higher risk here?
The guidelines urge extreme caution in elderly patients, and this is rooted deeply in the physiological changes of aging. As human beings age, our renal clearance, which is how efficiently our kidneys filter toxins and drugs out of our blood, naturally declines.
So the kidneys just work slower.
Yes. For an elderly man taking Tadapox, the Tadalafil might not clear from his system in 36 hours. Because his kidneys are slower, it might take 48 or 72 hours, leading to a massive accidental overdose if he takes a subsequent pill.
Because it's still stacking in his system.
Exactly. Furthermore, elderly patients inherently have a higher baseline of cardiovascular strain. The physical exertion of sexual activity combined with the extreme hemodynamic shifts and blood pressure drops caused by the medication can easily overwhelm an aging, fragile heart.
We have spent a lot of time breaking down the intense pharmacology, the severe contraindications, the liver enzymes, and the terrifying side effects. But what makes the iMedix platform so unique and honestly so compelling is that it doesn't just present this clinical data in a sterile vacuum.
It doesn't.
It provides a space for the human element. We are going to transition now to analyzing the actual user comments pulled directly from the iMedix database. We're going to explore how real people talk about this unapproved drug in the wild.
It is crucial to look at these reviews objectively. We are not validating their medical claims or endorsing their choices, but we are analyzing the psychology and the real-world behaviors of patients who are actively navigating this gray market.
It gives context.
It provides invaluable real-world context to all the clinical warnings we just discussed.
Let's look at the overwhelming sense of curiosity and profound confusion that surrounds these combo pills online. We have a comment here from an iMedix user named James Huang who wrote, "Is this a new one? Never heard of Tadapox for ED."
A very common reaction.
And another from a user named Oliver who asks, "That's an interesting combination. Never heard of that. Can you say a bit more about the effect and dosage you use? Thanks." These guys aren't asking doctors. They're asking strangers on a forum.
These comments perfectly illustrate the chaotic reality of the online medical landscape. These patients are likely searching for standard-approved treatments, and the internet algorithm serves them an unregulated, imported combo pill.
The algorithm just handed to them.
The novelty of it, the aggressive super pill marketing, sparks immediate curiosity. It highlights how dangerously common it is for vulnerable patients to just stumble blindly into these complex, unapproved pharmacological cocktails without any prior medical context, diagnostic workup, or physician guidance whatsoever. They are crowdsourcing their medical care.
And that leads us to the driving force behind a massive portion of this gray market, the financial aspect. We have a highly revealing comment from a user named Matt Warwick who states simply, "I think the price of this is good for the value it brings." Just my opinion.
That concept of price for the value is a massive, undeniable factor in patient behavior. We have to acknowledge the harsh reality of the modern healthcare system.
It's expensive.
FDA-approved medications, specialist visits, and comprehensive diagnostic tests can be prohibitively expensive for many people, especially those without robust insurance coverage. The intense financial desperation to find an affordable solution drives patients away from the safety of the regulated pharmacy and directly into the arms of unregulated discount online vendors.
So they see it as a good deal.
They are calculating a perceived financial value, but they are entirely factoring out the invisible, potentially fatal risks of counterfeits, lack of medical oversight, and severe drug interactions.
It is a risk-reward calculation made entirely in the dark.
Yeah.
But then you have the highly vivid success stories, which are exactly what fuel the entire online market. I want to read a review from a user named Miles.
Go ahead.
Miles wrote, "Yes, sex after using this agent is incredible. I have to say that in me, the effect lasted for about a day, and during this time my beloved did not let me move away from her. She was stunned after our sex. I, of course, blamed everything on the fact that I had not been there for a long time, and I had a lot of wanting for it during that time. I hope she believed it."
From a purely clinical analysis perspective, Miles's review is fascinating. Setting aside the very relatable, deeply human nature of wanting to impress a partner and trying to claim the chemical enhancement as his own natural stamina, look closely at the specific timeline he mentions.
Yeah, he explicitly states that the effect lasted for about a day.
He is experiencing the exact pharmacokinetic profile we discussed way back in Section 1. He is feeling the long, stable, 36-hour pharmacokinetic tail of the Tadalafil component. He is living the data.
But the irony is, while the Tadalafil was supporting him for a day, the Dapoxetine component, the SSRI, faded away within the first few hours.
Precisely. His subjective real-world experience entirely validates the pharmacological mechanics of the Tadalafil, but it also perfectly highlights the patient's complete lack of awareness regarding the dual, clashing timelines of the drug he ingested.
And in the middle of all these personal anecdotes, bravado, and confusion, we see the crucial role of the iMedix moderation team.
They play a vital role here.
Yes, the iMedix editorial team administrator actively responds to these comments. For instance, replying to users like Zach, who just casually said thank you for the article, and Henry, who boldly claimed it was the most strong drug combination.
Let's hear how they replied.
To Henry, the admin replies, "You sound very confident in your opinion, Henry. The way you describe the combination as especially strong and long-lasting definitely reflects why it catches so much attention. Thanks for adding your perspective."
That is an example of highly responsible, meticulously crafted moderation. The editorial team acknowledges the user's experience and facilitates the community discussion, but notice precisely what they do not do.
They don't agree with him.
They do not validate the medical claim. They do not encourage or endorse off-label use. They do not agree that it is a safe, effective, or viable option. They simply reflect the user's opinion back to them as a personal perspective.
That's a very fine line to walk.
In an online world utterly saturated with dangerous misinformation, fake reviews, and aggressive sales tactics, maintaining that strictly neutral educational boundary is vital for a legitimate medical database.
So what does this all mean for you, the listener? We have explored the deep science, the terrifying risks, and the community mindset. Where does a patient actually go from here? The iMedix FAQs provide a very clear path forward, outlining how patients can treat these conditions legally, safely, and effectively without ever resorting to gray market combo pills.
Let's talk about the legitimate options on the table.
That's the first step.
The very first step is breaking the conditions down and treating them specifically individually under a licensed doctor's care. If a patient is primarily dealing with erectile dysfunction, there are multiple, highly regulated, FDA-approved PDE5 inhibitors readily available.
Like the ones we mentioned.
You have Tadalafil, sildenafil, vardenafil. A doctor can evaluate your specific cardiovascular health, check your liver enzymes, ensure you aren't on nitrates, and prescribe the exact right dosage of the exact right molecule for your unique physiology.
And if the primary issue is premature ejaculation, how is that handled safely if Dapoxetine isn't approved here?
There are safe, targeted, regulated approaches for PE as well. The iMedix database mentions the use of topical anesthetics, which reduce localized sensitivity without altering systemic brain chemistry or serotonin levels at all.
So no serotonin syndrome risk there.
None. Furthermore, while Dapoxetine specifically is not approved in the U.S., many physicians legally and safely prescribe daily, low-dose SSRIs like paroxetine or sertraline off-label to successfully manage PE.
By separating the treatments, a physician can fine-tune the dosages of each medication for maximum efficacy and minimal side effects.
Completely avoiding the dangerous clashing timelines of a fixed-dose combo. It is about customized precision medical care versus a blunt, unverified, one-size-fits-all generic hammer.
But we also have to acknowledge that the unregulated market isn't going away anytime soon.
Yeah.
The iMedix database references other unapproved combos floating around out there, things like Super Vitalista, which is just another unregulated brand name for Tadalafil and Dapoxetine, or Kamagra Super, which swaps out the Tadalafil for sildenafil.
The internet is absolutely flooded with these permutations.
This raises an important question about the current and future state of sexual health medicine. Why are so many patients actively seeking out these incredibly complex, fixed-dose, unapproved combinations online?
They are taking immense documented risks with their cardiovascular and neurological health.
Instead of simply walking into a doctor's office to fine-tune separate, legal, safe prescriptions.
That is the ultimate question at the heart of this entire deep dive. It speaks volumes about the intense lingering stigma surrounding men's sexual health, the systemic failures in healthcare affordability, and the sheer manipulative power of internet marketing.
Marketing that promises a private and anonymous one-click solution to a deeply complex human problem.
It highlights a massive, dangerous gap between safe medical science and desperate patient behavior.
We have been on a massive journey today. We've taken you from the deep cellular science of smooth muscle relaxation and synaptic serotonin reuptake, through the terrifying realities of lethal nitrate interactions, liver enzyme blockades, and orthostatic syncope.
We really covered a lot of ground.
We have navigated the murky, dangerous waters of international gray market pharmacies and analyzed the incredibly vivid, very human discussions happening on the iMedix platform. We have unpacked the anatomy of a super pill and revealed the profound, irreconcilable contradictions hiding inside it.
It has been an extensive exploration. And as a crucial reminder, this deep dive utilizing the extensive clinical data and community insights from the iMedix medical content engine is purely educational.
Always.
Our goal is to help you, the listener, understand the profound biological and regulatory complexity behind the medications aggressively marketed on the internet. This is about empowering you with actual verifiable science so you never have to make critical health decisions in the dark based on forum rumors.
Knowledge is always the absolute best defense against misinformation. And as we wrap up this deep dive, I want to leave you with a final provocative thought to mull over on your own.
I'm listening.
We live in a truly unprecedented era of digital access. We have reached a point where we can order complex, brain-altering, and hemodynamically powerful chemical combinations with a single click, shipped straight to our doors, all in an attempt to secretly solve our deepest personal insecurities. But we have to ask ourselves,
What's the question?
when we actively bypass the doctor's office for the digital gray market, when we order these unverified clashing compounds to force our bodies to perform, are we actually taking control of our health, or are we willingly, perhaps desperately, participating in an unregulated global medical experiment on ourselves? Keep questioning, keep learning, and we will catch you on the next deep dive.